Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left canine, which seems to be impacted, as you can see in the 3D rendering right here. This is the partial panoramic view. You can see the tooth positioned impacted right here. Now this is the transaxial view. The tip of the tooth, the apex is towards the first premolar. As you can very clearly see, we don't think this is an impacted canine. We do believe this is a supernumerary tooth because we got 1, 2, and 3. The canine looks perfectly fine in its shape and size, but we still, however, evaluate for our doctor. So this is the canine, and this is where the supernumerary tooth is, right? So the canine has complete perfect anatomy. This is where the supernumerary tooth is. The supernumerary tooth apex is towards the first premolar, tip of the first premolar right here, and the tooth is positioned palatally and inferior to the sinus. Inferior anterior, and the apex is towards the midline. There you can see it's got a closed apex right here, and then we've got another tooth which is also impacted right here. So we've got two supernumerary teeth present here. The tooth on the top right side is on the mesial aspect of is distal to the incisive foramen, as you can very clearly see here. This is where the apex closes, and this is where we can see it. And then there's another supernumerary tooth here whose crown is towards the palate, and the apex does not seem to be completely closed and is on the left hand side, the distal to the incisive foramen. Now this is the axial view. This is the tooth on the right side, and now we're going to show you the tooth on the left hand side, which is one second. So if you notice on this view right here, my apologies, it's the same tooth which is crossing the incisive foramen, which seems to be like it is on the left side as well, but it's just one tooth, as you can see very clearly see in this segment right here. And then when you move right here, you will be able to see how this tooth goes from here, and there we go. So this is where it crosses the midline, where we feel it was slightly it was a second tooth, but it's actually the same tooth which has its apex crossing the midline right there. And then we've got one more view right here where we'll be able to show you that this is where the tooth is right there, palatally placed, and has a radiolucency around it and is palatally positioned. Thank you very much.